Hi there, my name is Cynthia Veronica, and today I want to talk to you about sleep studies. I have a 4-year-old son named Sebastian who has achondroplasia, which is the most common form of dwarfism. If you are a parent of a child with achondroplasia, it's likely that he or she may need to go through a sleep study at least once in their lifetime. So my son has had 2 sleep studies so far. So today I wanted to talk to you about a couple things that you may want to know going into your first sleep study. The first tip is to schedule a sleep study ASAP. If you have a child with dwarfism, one of the things that you'll probably learn very early on is that most doctors do not know a whole lot about skeletal dysplasia unless they are on the medical advisory board for the Little People of America, or if they've had a previous patient with skeletal dysplasia. Otherwise, your son or daughter's pediatrician may not have seen a little person in a medical capacity. Okay, so for this very reason, you may want to be very proactive in your child's medical care. Our son's first pediatrician was a very sweet old lady, and she admitted to us that Sebastian was her favorite patient. But even so, she just didn't know a lot about achondroplasia. And so it was really hard to figure out what specialists we should really be talking to and what concerns we should have just along the way throughout our son's medical experiences. So it was actually some parents of older LPs that actually told us, one of the things that you should do very early on is schedule a sleep study. So once it was on my radar, I actually called my pediatrician, set up an appointment, and asked for a referral to a pulmonologist. And I actually mainly did this because I was really concerned with Sebastian's heavy breathing at night. It was very labored. He was snoring very heavily, and we just weren't getting a whole lot of sleep at night. He wasn't getting a whole lot of sleep. And so it was really hard to get through the night, and we just wanted to do something for him that would help him. So the reason I'm saying that it's important to make this appointment right away is because for us, the pulmonologist was so hard to get an appointment with. I basically asked for the next available appointment, and it took months just to get that booked. And just a tip, an ENT or an ear, nose, and throat specialist can also be seen if you want to get an order in for a sleep study. So go to either a pulmonologist or an ENT or whoever you can get in with quicker in order to get this appointment set up. So once we were able to get our son in to see a pulmonologist, she was able to put in the order for us to get a sleep study for him. And so once I got a hold of the people that were scheduling the sleep study, it ended up taking a good 6 months just to get an appointment for the sleep study, just to get into the facility. And so I remember when I was on the phone with them, I basically asked, why is it taking 6 months? This is so long. And they basically said, this is actually pretty quick. It usually takes a lot longer. And the reason that we're seeing your son quicker than we normally would is because we put babies in as a priority. I know this can vary from location to location, and hopefully, where you live, it's easier. But for us, I just wanted to share, it took so long, and I was so concerned because I thought for sure that my son would need a CPAP. His breathing was so labored at night, and it was just so hard watching that. He would actually also tilt his head up whenever he slept. And from what I learned from talking to the doctors, that's actually to get more oxygen into the airway. That's just something that's innate, an innate response that the body does in order to get more oxygen intake through the respiratory system. So, that that was definitely something I was concerned about, and I kept stressing to the doctors and to the sleep study facility. But even so, they still couldn't get me in sooner than what they had originally offered me. So it is important to get the sleep study appointment booked as soon as possible. Okay, so the second thing you should probably know is that once you are in the room where the sleep study is conducted, they can actually hear you and see you the entire time. So my second tip is basically to just be very mindful of what you say and what you do. When we first checked into the room, the nurse or the sleep technician basically let us into the room, and then she left right away. And she didn't actually disclose that there were cameras and microphones in the room. And the reason that they have this is so that they can see you, but also so that they can communicate with you. Because even though they're monitoring everything, if a wire comes off and they need to come into the room, or if you're having problems, instead of having to leave the room and knock on the door where they're into the room where they're actually stationed, you can just talk into the microphone and just say, I need help, come in, or don't come in, we've got this. And it's basically just a way for you to communicate throughout the night. I didn't know, so when she left the room, I'm just glad I didn't say anything negative. Not that there was anything negative to say, but I'm just glad I didn't say anything negative about the nurse or technicians, whatever they were. And I'm also glad that, I ended up changing my pajamas in the bathroom. And I, for a split second, thought about just changing it in the room. But then I thought, what if they actually come into the room while I'm changing? Because I didn't know when they were going to come back in. So I went into the bathroom and I changed there. And then when I came back and I learned that there was a camera there, I was glad that I did that, because if I hadn't, then I don't know who would have been watching me, change into my PJs, because it's not just the person that's helping you, it's all of the different sleep techs that are actually in there, and their eyes are on the camera and ears are on the microphone. Okay, so the third thing I want to talk to you about is the sleep setup. The sleep setup itself is such that your child, or my child at least, for the room that we were given, had a bed with the rails on either side. So it was almost like a crib. Not quite, because it wasn't enclosed on the very end, but at least it was, it had rails that would come up and down easily. So if they needed to put on the wires or make any adjustments to the wires, they were able to do so easily by just lowering the rail. And then when he's back to sleep, raise the rail up again so that he wouldn't fall off the bed. We also had a full-size bed in the first facility where he had the sleep study. And so both parents were actually able to stay with him in the room. So we stayed with him at the first sleep study. The second facility that we had the sleep study at for Sebastian, there was actually just one sort of pull-out couch situation, and the couch was actually very uncomfortable, and it was only for a single person, and they told us that only one parent would be allowed to be with him. So it was a little different, but it was fine, and they did tell us ahead of time what would be allowed. But it's good to know ahead of time. It's also good to bring a teddy bear or a stuffed animal or something that your child is comfortable with, because they will be sleeping in a new environment, and it's unfamiliar and very hospital-like. So something to remind them of home or bring them comfort is kind of nice to have. Okay, so the fourth thing that I wanted to tell you was that there are a lot of wires associated with the sleep study. So the nurse will basically put wires on the baby's head, face, chest, and these wires will basically be adhered to their body with a sort of sticky gel. So I just remember him being very curious. He was holding onto the wires, he was kind of tugging at them, and it was really hard for her to really place the wires on properly. And so one trick that we finally used was we got the iPhone and distracted him with that so that she was able to put the wires while he was distracted and get that in. One of the things that they also had to do is put some tubes up their nose. And she said, babies cry all the time. Kids cry all the time with this. So it lasts maybe a few seconds, maybe about 20 seconds or so, but they will cry for a little bit. So just be prepared for that. The fifth thing you may want to know is that you will probably not sleep at all during the sleep study. At least for me, the first sleep study that we had, Sebastian was already not sleeping through the night. He was constantly waking up, and it was no different during the sleep study. It was just harder because rather than just trying to comfort him and put him back in his crib like we normally would do at home, you know, they would have to come back in, check up all the wires, and so the nurse was constantly coming in and out of the room throughout the night. And I remember as we were leaving the sleep study facility the very next morning, one of the things that she said was, we may not have enough data, and so you might have to come back for another sleep study. And I thought, what? Because this was a normal night for him. I mean, it's not like it was any different just because we were at the facility. If we were to do another one, the results would probably be the same. So luckily we didn't have to do another one. They were able to use the data that you know, from the original sleep study to determine what the results were and how we can move forward. But it was hard also because I had to work the next day, and because I was just up the entire night, it was just really hard. If you can, try to either take the next day after your sleep study off, or at least a couple hours so you can get a little bit of rest before having to go into the office or whatever your work situation is. Okay, so now let's talk about the results. And I am going to talk about it in real big picture. I'm not really going to go into too many details because this is something that just varies from individual to individual. So the sleep study can actually show one of two things. It can show whether there is central sleep apnea or obstructive sleep apnea, one of the two. And within those two categories, you can have mild, moderate, or severe sleep apnea. And obstructive sleep apnea basically means that there's some sort of obstruction getting in the way of breathing, and it's usually the tonsils or the adenoids, as was the case for my son. So he ended up having mild sleep apnea, and it was mild obstructive sleep apnea. I think another factor in achondroplasia is that because the anatomy is so compressed, I think the airways just tend to be smaller in general. And so that's also something else that's a contributing factor to obstructive sleep apnea. So the doctors really strongly recommended, I saw several doctors and they recommended that he get his tonsils and adenoids removed. I did see one doctor that was a little skeptical, and she did say, well, it's mild, it's not moderate or severe, so maybe wait a little bit longer. And ultimately, I'm not going to get into too much detail with this, but I do wish that I did wait longer. One of the reasons for that is because with removal of tonsils and adenoids, the tonsils, once they're removed, they're completely gone. They're not going to come back. With the adenoids, however, the younger they are, the higher the chance that they'll actually grow back, and they can grow back with a vengeance. And that's not something that the ENTs had told me, and that's not really a conversation that we had. I think it should have been. It would have helped me to make a little bit more of an informed decision, and ultimately I do think that I would have waited a little bit longer if I had known that. Okay, so central sleep apnea is the other type of sleep apnea. Central apnea means that there is a problem with signals in the brain that control breathing. One issue might be that there is compression in the spinal cord, specifically in the cervical spine, C-spine. And one thing that can really help with this is decompression surgery. The doctor may recommend an MRI along the spine to get a better idea of the severity of compression. And while they're at it, they may not just do the MRI on the cervical spine, but they'll also order for it to be on the lumbar, the L spine, which is something my son had done. It took several hours. We were in the hospital for a while, but they basically did an MRI up all along the entire spine. Another thing that they may recommend is that they sleep with a CPAP. So that's basically it. Let me know in the comments section if you have any questions or if you have any other information that you'd like to add to help others. Thank you so much for watching, and I will see you in the next video. Bye for now.